The new, very exciting and multidisciplinary field of health informatics aims to address issues within healthcare, such as delivery of patient care, improving health outcomes, and advancing patient education. This has clinical, managerial, and policy implications. One of the ways we're using technology to address issues like these is the use of EHRs, short for electronic health records, which basically work by patient data collection and analysis of their symptoms. So, an example of an EHR that I could think of is a simple health app on our phones that calculates like daily step count, calorie intake, and takes into consideration our height, weight, BMI, etc. According to recent healthcare IT news, researchers at the University of Manchester found that integrating patient data recorded on smartphone apps with EHRs helped identify disease trends. So while this study observed success on patients with rheumatoid arthritis, it could have the potential to generalize across many other health conditions that affect people today. The exciting technology of EHR, however, demands for professionals who could help with analyzing, maintaining, and predicting future health conditions with the large amounts of data. Not only that, with the growth in technology, we need design thinking to address issues of doctor-patient technology interaction. All in all, new advancements at the intersection of tech and medicine seem to promise enhancements to healthcare, but come with new needs and implications that need to be addressed.
Technology has helped informatics and information further evolve. Examples include healthcare and nursing information, which are both related to computer science and information science, to assist in the management of information. However, any new technology has an impact. Due to medical organizations have made the transition from paper-based system to electronic health record software, it's critical to be mindful about the impact on quality and safety. Therefore, we have clinical, managerial, and policy implications. One of the major challenges of utilizing an EHR software may be the amount of data that all hospitals and healthcare organizations have to manage and analyze. For this reason, professionals well versed in both medicine and informatics are in high demand. The American Medical Informatics Association spearheaded the establishment of professional level education and certification for physicians in informatics. Nowadays, Meaningful Use incentivizes providers and hospitals in general to use EHR system. I strongly believe that it is a tool to help change how work is done.
Technology is present in the clinical setting through the use of online portal systems, electronic medical records, and data collection. In 2009, President Obama signed the American Recovery and Reinvestment Act into law, which provides incentives for providers to use their electronic health records, also known as EHRs. And some providers have lied and edited their documentation illegally for their use of EHRs to get monetary incentives from the Meaningful Use program. On the other hand, healthcare staff will be able to provide evidence-based care using EHRs to quickly access patient information. And with the use of EHRs and medical mobile apps on the rise, it is crucial to have policies in place and protects patient information and their privacy. And it's also important to have patients' information transparent and to know how their data is being used and to make sure that the necessary people have access to their data. Lastly, the federal and state level regulations on health IT are not coordinated, which can lead to conflicting health incentives, and state systems may not have access to national health information infrastructure and do not recognize other states' healthcare systems.
Not only does technology play a crucial role in a clinical setting, but it also plays a crucial role when it comes to policy implications. The large amount of data that companies deal with, whether it's from health records or from different information systems, is larger than they've ever dealt with before. And this affects policymakers' decisions when dealing with public health issues because of health professionals not dealing with the data in a proper manner. When dealing with this data, companies have to ensure that everything is HIPAA compliant. HIPAA is short for the Health Insurance Portability and Accountability Act. And basically, this act sets a certain amount of rules and measures that companies have to deal with when dealing with patient health information, whether it's on a physical level, network level, or administrative level. I've personally dealt with an electronic health system in a previous class, and I can confidently say that having something HIPAA compliant within 10 weeks is not doable. If a health professional dealing with this data is not properly coordinated, and then with these certain policies, it looks bad on policymakers. It eventually shatters this big block of trust that they've built and may potentially even lead to bigger financial complications in the long run, just trying to fix it.